Mr. President, I'd like to spend a little time today talking about what has become known across the country as the Obama economy. This administration, after nearly 4 years, has failed to get this country and to get our economy moving again. Even worse, as I look at it, this administration seems to be taking steps that appear to be methodically and deliberately sabotaging certain parts of our nation's economy. They're doing this in sectors of the economy that apparently, to me, they just don't like. And they're doing it by issuing thousands and thousands of pages of red tape on the very people in this country who have in the past successfully created jobs for Americans. This administration has finalized 1,330 rules that have been deemed what's called economically significant. They proposed over 1,300 additional economically significant rules. So what does this mean, this term, economically significant? Well, those are rules that have an annual impact on the economy of $100 million or more. 57 coal-fired power plants have already announced their closure because of the cumulative effect of these rules on just this one industry. The EPA is proposing regulations on whole sectors of the economy, whether it's issuing new stormwater regulations for existing buildings to requiring costly Clean Water Act permits. They're doing this for ditches on family farms. Thousands of Americans' jobs have already been lost, and others are on the chopping block just due to these rules. Not a new law that's been passed, but the rules that come out from this administration. Each time that the EPA claims that the benefits of the rules vastly outweigh the costs. But the costs are real in terms of real dollars to the economy, and the benefits are unknown. The administration claims that the benefits are in so-called, quote, saved future health care costs. That's how they define it, saved future health care costs. The EPA and this administration has a history of understating the costs and of overstating, in my opinion, the benefits. The EPA's math on the benefits and the costs of their rules is not even close to being accurate. Now, this has been verified in testimony before the Senate Environment and Public Works Committee, of which I serve as a member. The EPA rules that set new burdensome limits on emission of pollutants such as carbon dioxide, mercury, and sulfur dioxide, well, those rules can have serious costs to plants and factories that then have to upgrade their facilities with costly equipment or simply close to be under the new standards. New standards, not the old standards, but new standards. Those reduction yields few quantifiable benefits to the economy, and that's not me saying it, that's the EPA's own models. They admit that the reductions yield very few quantifiable benefits to the economy. The costs are usually significant to the businesses in terms of the actual expenses, as well as to the public, to the people looking for jobs, in terms of jobs that are lost. The EPA knows no one would buy into their rules with such high price tags. So in order to inflate the so-called benefits of their rules, the EPA says that as a result of having less emission from plants and factories, there must also be reductions in particulate matter or dust at the same time. Well, they then make the inaccurate conclusion that reductions in the dust will somehow yield billions of dollars in health benefits because folks will have healthier lungs and visit the doctor fewer times. These reductions in dust are often in areas where the dust level today already is well within public health safety standards that are set by the EPA. So the folks aren't actually getting sick in those areas anyway. So if people aren't already getting sick in the areas where the EPA is trying to regulate the air, then how is it that they can claim that they're going to save billions of dollars in fewer times and visits to the hospital by reducing the dust levels even fewer than today's safe levels? What we know now is that the EPA is cooking the books. At the same time, they're missing the real public health threat that they themselves, the EPA, is making worse. That is the public health threat from high unemployment. I recently released a report, and it's entitled Red Tape Making Americans Sick, a new report on health impacts of high unemployment. Red Tape, Making Americans Sick, a new report on the health impacts of high unemployment. Studies show EPA rules cost Americans their jobs and their health. This is a report submitted by the Subcommittee on Clean Air and Nuclear Safety by the minority subcommittee staff, and I ask, Mr. President, that this be included in the record.
Without objection.
Thank you, Mr. President. Mr. President, this is a comprehensive report, and it contains expert testimony before the Senate Environment and Public Works Committee and the best scientific medical research from institutions such as Johns Hopkins, Yale University, and others. This key medical research and testimony on the impact of unemployment on public health is irrefutable. The report concludes, high unemployment increases the likelihood of hospital visits, of illnesses, and of premature death in communities. That's high unemployment. High unemployment raises health care costs, raising further questions about the claimed health savings of the EPA's regulations. And high unemployment hurts children's health and family well-being. On June 15, 2011, Dr. Harvey Brenner of Johns Hopkins University testified before the Senate Environment and Public Works Committee. Here are the facts. He says, quote, "The unemployment rate is well established as a risk factor for elevated illness and mortality rates in epidemiological studies performed since the early 1980s. Well-known fact now for over 30 years. In addition to the influences on mental disorder, suicide, and alcohol abuse and alcoholism, unemployment is also an important risk factor in cardiovascular disease and overall decrease in life expectancy." And I come to you, Mr. President, as a physician, someone who's practiced medicine in Wyoming, taking care of Wyoming families for a quarter of a century, and I will tell you this is perfectly in keeping with my experience of the years of medicine that I've practiced. Yale researcher Dr. William Galo's paper on the impact of late career job loss reports, quote, "Results suggest that the true costs of late career unemployment exceed financial deprivation and include substantial health consequences." Substantial health consequences. He goes on to say, "Physicians who treat individuals who lose jobs as they near retirement should consider the loss of employment a potential risk factor for adverse vascular health changes." So what's that? Well, it's stroke, high blood pressure, heart disease, major killers, major things that result in disability, in long-term problems, and in increasing the cost of care. So let's look also now at the impact of joblessness on children. The National Center for Health Statistics concluded, quote, "Children in poor families were four times as likely to be in fair or poor health as children in families that are not poor." Well, I have seen, Mr. President, firsthand how economic challenges affect Americans' health and the quality of life. In my medical opinion, this country faces a worsening health threat from unemployment. Now, well over 30 months of unemployment rates well over 8%. Now, I've urged the EPA to seriously consider the impacts of these rules and the new rules they continue to come out with, these rules, and how they have a bad impact on families, on pregnant women, on children, on the elderly. The EPA has not looked at these serious health impacts that their rules result in. The EPA continues to hide behind computer models, not real people, but computer models that churn out inflated, fictitious, so-called benefits of health. The time to get serious about public health is now. Now, in fact, there was a USA Today article on Monday of last week, and I brought a copy along because it was very disturbing, Mr. President. It's a copy on the front page, USA Today, Monday, April 30th, 2012, Police Tie Domestic Violence Economy. Survey, incidents rise after financial collapse. The article states, Mr. President, that police are encountering more domestic violence related to the sluggish economy, a national survey of law enforcement agencies find. These are law enforcement agencies across the country, their national survey. The article quotes Camden, New Jersey Police Chief Scott Thompson, who stated it is, quote, impossible Chief Thompson says, impossible to separate the economy from the domestic turmoil in the city where unemployment is 19%. Camden Police Chief Scott Thompson went on to say, quote, when stresses in the home increase because of unemployment and other hardships, domestic violence increases. He says, we see it on the street. So, Mr. President, these types of reports of increased domestic violence due to unemployment are not just being reported in Camden, New Jersey. The article cites Chuck Wexler, executive director of the Washington-based law enforcement think tank, who expressed serious concerns with the rising violence. He says, you're dealing with households in which people have lost jobs or are in fear of losing their jobs. Because there's a lot of fear out there, Mr. President. He goes on to say, this is an added stress that can push people to the breaking point. And I agree, it is certainly what I saw as well in my days of medical training and medical practice. The health crisis from unemployment under this administration is getting worse. In May of 2012, Christian Science Monitor, just May 4th, their article on the unemployment rate says, quote, while the economy added 115,000 net jobs in April, some 350,000 Americans gave up looking for work. So for every one new job that was added, 3 people gave up looking for work. That has the effect of reducing the unemployment rate because by the federal government way of calculating it, those people no longer count as part of the labor force. As a result, the share of Americans who are part of the labor force, either working or actively looking for work, has reached a 30-year low. You can add those numbers and look at those and say 350,000 people and put that to the list of folks who are now at risk for serious health impacts due to the Obama economy. If we want to make Americans healthy, we need to get Americans back to work. We need to get the EPA out of the business of making folks unemployed across this country. Each new job is a job that will put food on the table for struggling families and help keep medical costs under control. New jobs will keep thousands of Americans out of the doctor's office and onto the playground. Creating jobs will keep those nearing retirement from paying for more prescription drugs so they can spend more time and money on their grandchildren. Creating jobs will ensure that the next generation will be healthier than the last. Let's work together to improve public health by reducing this administration's red tape that is putting so many Americans out of work. The health and happiness of the American people depends upon it. Thank you, Mr. President. I yield the floor and note the absence of a quorum.